All right, Dr. DeCubelos here. We're going to go look at a digital motion film of the neck or cervical spine. So here we go here. So I'm going to pause it right there. So again, if we take a static film or a normal x-ray, this is all we're going to see. We're going to get a side view, see this person's facing this way. This is their jaw and their teeth right there. We're looking at the vertebra, which are right here. A couple things we're noticing. Disc spaces, we're comparing and looking at them. We can see that back in here, it looks like we've got a little bit of more bone growth back here. You can see there's less space than there is up here. Also right here, less space, less space. You can see there's no curve. It should be curving this way. If anything, it's going slanting or maybe going a little bit forward. But again, if we didn't have any motion, that's about where we'd end. So let's see what happens when this person starts moving. All right, so I'm going to pause it right there, and I'm actually even going to go back a little bit here. So as soon as they start, pay attention to these two areas, okay? What we're looking for is we want to see that every vertebra is moving together as one motor unit. And right there, you can see this one starts to shift forward, leaving this one back. See how far back this back of the vertebra is compared to this one? And then same thing here. You can see it's moving. See it's shifting even farther forward right there. And as he gets to the end, now you can see this one kind of moves into place over here. So what's happening is that we've got some ligament instability back here. As this person is moving, the muscles that are attaching back in here try to guard and protect this area. So they're trying to pull this back because in here is where your spinal cord is, and back in here is where all the nerves exit. So they want to have as little pressure on that as possible. Your body does. So it would rather have these held in place than potentially moving and having a vertebra move into the spinal canal. So we're going to go ahead and play this again. Now watch, going to come back. Now you see that again. If you look at that right there, you can see that motion right there over that segment. It just, see how now it comes back and they're completely even? So the instability was when they were putting their head forward. So let's see what happens when they go back. Starts to get a little dark there. But we can see a shift of these vertebra. When I copy this over, it got a little too dark, but right here we can see that shifting. So that's what we're looking for, because that means that we've got some ligament instability. This person might have been involved in a car accident, might have had a whiplash injury, might have been something that was from sports. But typically these are the patients that come in that they have chronic complaints. Maybe they were minor in the beginning and they've gotten worse or haven't gotten better. So we always like to check for these, because if this is what's going on, it means that their treatment has to be completely different than what they've done in the past. And we have to make sure that we work on getting these things to heal as best as possible. So it's really a biomechanical issue. So really, really important, because again, if we would have just taken that static or non-moving x-ray, we would have never known about this at all.